Hi, it's Dr. Brad Guyton, and we're back with our Smile Power Hero of the Week. We've got Dr. Lonnie Johnson with us. He's the Senior Associate Dean for Clinics and Professional Practice over at the University of Colorado School of Dental Medicine. Dr. Johnson, thanks so much for being with us today.
Good to be here, Brad.
Congratulations for all that you've been doing, and really appreciate all the contributions you've made. Quickly jumping right into it, you serve in a very unique role over at the dental school with a patient population of almost 80,000 people. What are some of the challenges you guys have had, especially being affiliated with hospitals as well, during the last 3 or 4 months?
Well, we've had the normal challenges on top of the COVID challenges. Life goes on. The hospitals see emergency patients. They see patients, getting them ready for transplants, bone marrow transplants, chemotherapy. So we've had that added stress, as well as just trying to provide emergent care to our patient population.
Yeah. Such a broad mission over at the dental school, and at the school, so many resources available through other departments and other aspects of the university. How have you leveraged some of those resources?
Oh, yeah, no, we definitely have resources available to us the practice community doesn't have. I mean, as an example, we have a director of quality and patient safety that we can rely on, understands how the public health system works. We also have, individuals on campus like environmental health and safety, as well as quality management in the hospital that we can ask questions of and rely on for support.
So you spoke about safety a second ago. Talk to me a little bit about when you speak to patients through the clinic, what do you tell patients? Is it safe to return back to the dental office?
Well, I think one of the most telling things right now is that there hasn't been an outbreak of COVID in any dental office. And I think that is a very positive thing through my mind. The other things is that the couple of occurrences we've had in the building have been more socially related than they have been therapeutically related. So we understand that's part of the problem, and through that mechanism, we actually kind of understand maybe being here in the building is a little bit safer than being on the outside in public. So, yeah.
So early on, obviously, students that were planning to graduate this month and early on in February, a huge challenge in addition to serving your patients, just to get the fourth-year dental students to that graduation date. What did you do specifically and uniquely to help those students?
Well, luckily, our Office of Academic Affairs adapted very quickly to the problem and converted, almost all of our in-person learning to an online format. So that was very helpful to keep the continuity of the didactic education going. We also had some rather imaginative efforts on our staff's part to move our simulators out into the main clinic and establish some distancing. And so we were able to resume simulation a couple weeks ago for our senior students, and now the bulk of them have graduated or are finishing this week. And we've been able to extend that to begin to meet the simulation technique needs of our underclassmen. And all that together has led us to a path where we're going to start some limited patient care on June 1st.
No small hurdle for sure. At some point, maybe in June, you get to actually sleep for a night.
Yeah, no, actually, I feel pretty good today. We've made a lot of progress, and it's been gratifying to get us back on a more positive course. Yes.
Looking forward over the course of the summer, what do you see different at the dental school?
Well, right now, with the resumption of patient care, we certainly see that as a little bit of a problem to try to scale that up so we can have some meaningful patient care. We also have concerns about, the general financing for dentistry. We rely on adult Medicaid, we rely on state-funded senior dental care to provide some financing for our patients, and right now we don't know where that funding is going to be. We also have, just general concerns about whether patients are going to come out and seek some elective dental care.
Right, absolutely. And same, very similar concerns as many of the people in private practice as well. If there was a story or a highlight for you over the last few months about your faculty or things going on at the school, what were some of those things that maybe warmed your heart?
Well, I think, the big picture thing is to see how well everyone worked and how hard everyone worked to get us back online. I mean, I'm very proud of all our faculty and staff and the energy they put into this process and the original thought that they put forth to solve many of our problems. Another part of this, through the CDA COVID task force, I really saw a number of our alumni step up and be leaders, and that was very gratifying as well.
Yeah, well, and we really appreciate everything that you've done. You're obviously a very humble guy, but we know you're a big servant leader, and you've really taken with some of the leadership from Dean Castlebaum as well. Just want to say thank you for everything that you've done and that Dr. Castlebaum has done and the rest of the faculty over at the dental school in not only helping the seniors graduate, but also in all of the patients that you've served. It's Dr. Lonnie Johnson. He's our Smile Power Hero of the Week. Dr. Johnson, thanks so much for joining us today.
Thank you, Brad.
Stay healthy out there.
We will.